I just got an email and I am absolutely terrifying. I'm shaking. I don't want to open this. I'm literally shaking. Okay. Step 3 score. View score report. I don't want to look. Oh my God. Oh my God, thank you, 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 God, thank you, God, thank you, God. I passed! I passed! 10 points over. Thank God. Thank you, thank you, thank you, thank you, everyone. I did it. I passed. I did it. I'm finally done with step 3, step 2, step 1. I passed. 20 points better than last time. I can get my license now. I will become a licensed doctor now. Now I'm shaking because I'm happy.
Hello, everyone. My name is Dr. Moss, the psychiatry resident physician, and today I'm sharing a very personal and difficult story. I failed step 3. Yep, I failed step 3 as a first-year psychiatry resident. That was last year. I guess at the beginning of this year. But I just found out earlier this week I finally passed it and did over 20 points better than I did last time. So let's first just acknowledge that it is okay to fail, no matter if it's USMLE 1, 2, or 3. Yes, I also failed step 1 twice, but it's okay. I'm still a doctor. I'm still a psychiatry resident. It's the same for you. Just because you fail an exam doesn't mean that it is the end of the world. Trust me, I get it. It does feel like the end of the world. It's emotionally devastating to fail. And I've now helped tons of other medical students and residents also get through a step or COMLEX level exam failure. This isn't just a motivational talk. I'll actually show you exactly what I did differently and how I studied, what I specifically used, and how I turned that failure into bumping up 20 points and 10 points above passing. So let's get into my exact study strategy, how I completely reworked my approach and ended up passing. So I'll share my exact step 3 study plan, the resources, and specifically the CCS strategy that led me to go from burnout to passing. So if you haven't already, make sure you like and subscribe, and I can share my strategy that I hope will help you, whether you failed or you're about to take the exam. So first, like I said, it is emotionally devastating to fail an exam. We put so much into these exams, it becomes our identity, and that's a problem. When we start to think that how we score an exam is who we individually are, that's where we can really get into some very messy situations. I remember the first time I failed my step 1 exam, I felt like I was done with medicine. I felt like I was never going to become a doctor, never going to match. It even got so bad that I even contemplated suicide. That's not right. Does that make sense? Like, why does this happen? We put so much pressure on ourselves, and it's just an exam. Yes, it will determine if we eventually can graduate or get into residency, but just because we failed once doesn't mean we will actually get to those points. Even though I was in residency already, it still emotionally hurt me. I'm glad that I didn't get to that very negative point, but it really emotionally hurt me. I remember I was upset about that because I had failed before. I was already in residency, and I was very angry at myself that I had failed. What I recommend all medical students and people who fail exams is to take time away to mentally reset. And so that's what I did. I did not study at all. I took time to focus on my mental health, keep going to therapy, eating, sleeping, regaining my own self-confidence, connecting with the things that I'm passionate about, like making videos to educate medical students, connecting with my medical student research group, getting a chief position and doing those sort of things, and working on being a psych resident. You really can't cram your way out of that mental state. You really have to let yourself rest, reset, before you can go again. And that's with anything, no matter where you're at in your journey. So the biggest thing I learned that led to my failure is I did not focus on CCS cases. I thought, oh, it was at the second day of STEP, the last half. I was like, oh, that's a small portion. When really, that's 25% of the exam. I didn't really start doing the cases into closer to the actual exam. I was treating step 3 like step 1 and step 2 by focusing on Uworld and practice test, which is still good and important, but it's not enough for step 3. The big thing was that these cases really bring in the knowledge that if you're an internal medicine resident, you'll probably be fine because it's what you do on a daily basis. You pull up these medications, you order these labs, they're just second nature to you. Now, for residents that aren't internal medicine or are taking a year off, these were completely new to me. Instead of just saying a random diuretic, I had to relearn those actual names, furosemide, and learn when to use them, when not to use them, what diagnosis is, and what point of the medical condition. That was a huge part. When I originally took my first exam, I only did the top 50 high yield. And I thought, oh, I'm doing the high yields. But what I missed is we are self-choosing what the high yield. It's not what the CCS and NBME is choosing high yield. It's us that are choosing high yield. And this also caught me. I thought there was going to be the exact same cases. They're not. Those are just practice, just like UWorld. It's to get you practicing like the exams. The same exact cases are not going to be on the exam. So even though I did all 179 and I did some of them multiple times, they were not the same. Some of them are very similar, but they're not identical. So from the very beginning of my STEP retake studying, I took time every single day to do 4 cases a day. It took about an hour, so not that much time out of my personal residency, but oh my God, once I started doing the CCS cases, it became second nature. And I noticed I was even doing better at UWorld when I was doing the cases because I was learning how to think in that way, to think about specific names of medications, specific names of labs, order of when to order one thing versus another thing, highest likelihood of a diagnosis. Next step, that's a big thing that you do in these CCS cases and on UWorld, they're more likely to say, okay, it's this diagnosis, but what's the next step? What are you going to order on discharge? What tests are you going to confirm your diagnosis? Things like that. Another big thing that I did halfway through my CCS cases is I started to create a spreadsheet on my notes app, putting down every single diagnosis and case, what were the most important labs that I ordered that maybe I forgot or just were not intuitive, because there are definitely some, no matter for every single case, you always order common things, like easy points, but the ones that aren't, or there's like nods part of it. For a CT, sometimes you do with contrast versus without contrast. So I created that worksheet of the labs to order, what medication to order, they had to keep them in the clinic, in the ED, discharge from the ED, or go inpatient, because that also was something I struggled with. For example, kidney stones. I thought originally that you had to put the person in the hospital, but if they're smaller than 10 millimeters, so 1 centimeter, they can just pee them out at home. So you just give them like pain medicine fluid and send them home. Every single time I did one of those cases, I would add them in, and they got really long because there's 179 cases. But then I would review them each night. I also, by practicing the strategy of you read the patient, do a physical exam, and then you don't always do every single physical exam. Sometimes you only do like when it's something that looks like it's going to be severe, the most critical, like lungs and heart, for example. And then labs. It's very important to not order the medication before you do the labs. They ding you on that. So, labs, order the meds, and then keep going, and then maybe move them. A big thing that I had to get used to is consulting. They want you to consult certain individual specialties, but then you do the procedure. For example, I think when there's an abscess, you have to do the procedure, but for surgeries or a heart attack, you have to consult the surgeon and then put in the actual type of surgery. All these little things. I'll put my spreadsheet of what it did on my blog post connected to this step 3. Hopefully that will help you. Also, a big thing about these cases, the first time when I failed, I really focused on doing the cases in the Uworld. They're a good starting point. Same thing. I don't think I have it right now. I think I gave it to an intern who's studying. The first aid, step 3, also goes through the cases, which is helpful, but it's very easy to go into passive learning. The best is doing cases until it becomes muscle memory. The next thing that I did poorly was the biostats. Just the second day is mostly CCS cases. The first day is mostly biostats. That definitely threw me off guard the first time I took it because I did not practice biostats enough. And I definitely messed up one of my, I think I did the relative risk reductions anyway. I messed it up. I recreated my biostats sheet, so I'll also make sure I include my biostat sheet that I created on my blog post, and you can really see like I made sure my equations were correct, and I rewrote my biostat every at least couple days, or once it go closer every day, so that the moment that I got down and during that orientation slide, I just did my entire paper of my biostats. Thinking about it, I don't know why I didn't do that originally, because I've definitely done that in step 1. I did that in pre-med and the MCAT, like writing out the physics equations. So it's definitely helpful because in the stress of things, if you miss up, do a plus versus a minus, or the C versus a D, like it's easy to mess up. I worked really hard on that, and I think that helped tremendously. I don't know why I didn't realize how important the biostats on Uworld. Like I did the regular biostats, but there's an entire other section. Make sure you do those. They have some good learning and they had some good questions. So I made sure I did all those this time. And then I also watched some YouTube videos, which I'll include, that really helped me perfect them. Shout out to those YouTubers that are great at biostats. I also pulled out AMBOS and did some of their biostats to really get extra practice because I knew that was where I was struggling the most. Okay, next, Uworld. The first time I did step 3, I did 3/4 of my questions. So I finished up the questions and then redid the ones that I had flagged so that I wanted to come back. And then I also I did not, the first time I did it, I didn't do there's an entire 500 questions that are step 2 focus, but this is the weird thing with step 3. It is a lot based on medicine from step 1 and step 2. So things that I hadn't even thought about for years, like Marfans and all of these things. So it was actually really helpful to do those UWorld from step 2. It's step 3. It's not super specific, as in specific genetic tests. However, it definitely pulls in a lot of fungi, all the bacteria, because they have antibiotics or antifungal. So whenever there's a connection of any type of medication, it's gonna show up on step 3. I've also heard just the fact that step 1 is pass fail. Maybe that's why they're putting more emphasis on bringing in those basic science concepts. Feel like there was also a lot of immunology stuff that you don't think about for many years. So definitely a lot more step 1 stuff. So back 4 or 5 years ago. So definitely wanted to make sure you do those. And something that was really helpful is I started doing divine intervention. I can't believe I've never done it before. I guess because there's so many resources out there all through medical school. And I just hadn't had that opportunity because you always are freaking out when you're a med student of not having enough time. For the first time, I had the time. And so when I was driving to my forensic rotation, it was about an hour away. So I listened to an hour there, an hour back. That's how I pumped through almost the majority of the divine interventions that were definitely the ones that said anything to do with step 3, and then anything to do with broad based science and medicine, like high yield cardiac, high yield pulmonology, high yield biochem. I thought it was really helpful because it's starting to prime my memory of things that I had heard of years ago, but I had completely forgot. So even though I don't normally encourage passive learning, I turned it into more active by pausing it often while I'm driving, which was on my steering wheel, and try to answer it. Because you know how a Devine talks that he says something and then pauses it? He asks us a question, then pauses. So that's a great time to pause it and answer it out loud. He also makes some phenomenal cross references that I know some people don't like, and I know I didn't like as a medical student when I had tried it briefly because it seemed too much. But now, preparing for step 3, it was perfect and actually allowed me to really connect everything in my mind. Okay, so we mentioned that. We mentioned UWorld, we mentioned supplement. Oh my God, of course, the practice tests. And you always learn from your mistakes is the big thing with when you fail. And that's the most important thing. My mistake was I didn't do the free 140. I don't know. So I did the free 140 not as a PDF, as the actual questions, which I didn't even know they had. So did those this time around. Scored 59%, which I thought was pretty good. I did UWorld Step 1 and Step 2 practice exams, which I passed both of them, which brings me to the thing that I tell every single person, whether they've passed or failed steps in the past. Never take the exam until you've passed your practice exams. If you're too close, if something happens during exam, anxiety, difficult questions, there's a greater chance that you're going to fail. So always make sure that you've passed and by a good amount. Sometimes you have to go based off of -1 standard deviation from, or a +1 standard deviation from passing. From what I've noticed, I think the passing score is usually -2 standard deviation versus the mean, and so just how the curve is. So if you're at -1 standard deviation, there's a greater chance that you're going to pass, and that's how I was. Step 1 and step 2, I passed, and it was a good amount. I think I have that I passed 204, and I think the passing is 200, but I did those first in the initial month, and then I moved to NBMEs. So then I did NBME 7, which I don't know why I did that one first, but I did 7 first. And I passed at 319, which is that one standard deviation. I was so proud of myself because the first time that when I failed, I only scored a 290. And so that's a significant, what is that? 20, 30 points over. So previously I had barely passed. This time I had comfortably passed. And then I did the MBME number 6 and I scored a 502, which was around mean. I had never in med school, or in the step exams ever scored the mean amounts. That made me feel personally very comforted and happy and knew that I was ready to take the exam. And the first time I did it, I scored 409, which was passing, but this time this was over almost 100 points over from my previous time. So even though I wasn't hitting the best, my goal was to pass, and so I focused on being right above passing, and it worked. The last little things I'll add is I didn't watch all of the sketches, but I knew that I need to brush up on some of the bacteria, the fungi, the antibacterials, antifungals, anti-TB meds. So I definitely did those, which is so nice because every single time you watch it, you remember it more and more, and it clicked. So I do want to finalize and say failing step 3 doesn't mean you're a bad doctor. It means you just need a different approach. You need to reset and try again. So please do not give up. Focus on mastery, not just memorization. Did I answer your question? Do you have any more? Please put down in the comments whether you passed, whether you failed. I don't care. Add in your question because I'm sure someone else has the same exact question or strategy that was helpful for you. As a quick recap, I did CCS cases every day. I rewrote the biostats question on a practice form and then also on the actual day. I reviewed my flagged questions from Uworld, and then I tracked my progress to make sure I was increasing and not stagnating, and I was over the passing score. So I hope this rework of my approach not just will help me, but also help you. If you want to see the first video, check that out. It was right after I failed. I feel it is very meaningful. A lot of people have reached out to me how helpful it is to know, one, that they're not alone, and two, in the moment, I mention a lot of things. I noticed I had messed up, so it's helpful to hear what things right away I knew I had messed up that I needed to rework my strategy. So I hope this was helpful for you. I know it was a much requested video, and I just want to appreciate all of you for supporting me, all my ups and downs. I am now officially done with all the steps, and I can start applying for my license and don't have to worry about steps anymore. Next one is board exams, and whatever your specialty is, that's what your board exams are. For psychiatry, it's psychiatry and neurology, which on our practice exams that are called PRITES, I score way above average. So that shows that I love psychiatry and neurology and just what I'm good at. So I'm not worried about my board exams. But I hope this really helps and inspires you. Make sure to subscribe and like. I'm going to put also in the description and in the comments the blog post that goes through these, also the CCS cases and my handwritten equations. Thank you so much for listening and good luck on your exam. Take care, everyone.